Gosh, I feel I'm a bit short for this podium. So hopefully we'll manage. Do you know, I'm gonna. I'll just improvise, okay? Because I don't want to look like a head on a plate. So thanks very much for the introduction and for inviting me here today for the annual Stop the Deaths conference. Now, as you know, I am still relatively new to the position of Minister for Drugs and Alcohol Policy and Sport, but I have come to this portfolio knowing the huge weight of responsibility that sits with us in terms of dealing with the challenges associated with problem substance use and the desperate need to improve lives and the health outcomes of the people who are affected by this. 2 weeks ago, I opened the expansion of rehabilitation accommodation at Crossreach in Inverness, and I'll say a little more on that in a moment. But I want to start by reflecting by just how struck I was by the atmosphere I felt at Nevis House. Across the staff, the volunteers, and the people benefiting from the service, I could feel the mutual respect, the care, the love, and hope. It impacted me, and I want to speak directly to the people who are impacted by addiction. I want you to know that you matter. I care about you, your future, and your families, and I am determined to do my best as Minister to continually improve how we support you. I'm aware that yesterday there was a number of my MSP colleagues on the stage, and there was some really interesting discussion about how we can best address the issues that we face here in Scotland. And I can assure you that I am committed to working with my colleagues across the Parliament as we continue to strive to reduce the deaths and harm from drugs and alcohol. This isn't just a public health imperative, it's a human rights issue. Everyone has the right to health, to life, and to be treated with dignity and respect, regardless of their circumstances. Now, this Sunday will mark International Overdose Awareness Day. It's a day to reflect on the tragic loss of loved ones and to rededicate ourselves to pushing forward to make change. My hope is that through our national mission and our plans for what will follow the election in 2026, we will move forward to a Scotland that is no longer suffering from one of the highest drug death rates in the world, and where people's rights are always respected, and where they can receive the support and treatment that they need when they need it, without the barriers of stigma and penalty. Our national mission has delivered a huge amount across the country as we seek to reach that goal. That includes a wide breadth of activity, from funding the first safer drug consumption facility in the UK to delivering new residential rehabilitation facilities and increasing the number of publicly funded placements available. Now, I mentioned my recent visit to Nevis House in Inverness, the new Crossreach residential rehab service, and how blown away I was by the work that was being done to provide support to people who are in recovery there. Hearing the personal stories from some of the residents and sharing my own experience of growing up in a family dependent on alcohol, I could feel the life-changing work that happens in Nevis House, and I came away feeling really hopeful that that facility is going to make a change for the people in the Highlands and Islands. I was also encouraged to hear from quite so many women within the service, particularly because we know that women face so much more additional stigma when they are seeking treatment. Next week, we'll see the annual publication of our drug-related death figures from the National Records of Scotland. I'm under absolutely no illusions as to the tragic loss of life, which these statistics reveal. Each number is a is a person who has lost their lives. They have a family who are grieving them, and it's a loss of potential for our communities. These are preventable deaths, and we'll continue to do all that we can to prevent them. This government is providing record levels of funding for drug and alcohol programs, and we've widened access to treatment. For example, the use of long-acting buprenorphine, and I was delighted to arrive in time to hear the Scottish Drug Forum's peer-led evaluation on this. If we have time at the end, I'll answer the question on access from, well, if my minders will let me. It's really vital, though, that we hear the views of people receiving support from these services, because it's their voices that need to be at the centre to enable us to consider the findings and the recommendations and to inform future improvement of our medication-assisted treatment standards, both within the community and within justice settings. It's also crucial that we continue to stay alert to changes in the drugs in circulation, recognising those new threats that come with these. Improving our drugs surveillance capabilities has been another core part of the national mission, with public health run radar surveillance system right at the heart of that. The updated alert issued on the 12th of August in relation to synthetic opioids underlines the absolute importance of being able to identify and respond to substances of concern. We know that these synthetic drugs can be hundreds of times more potent than heroin, significantly increasing the risk of overdose, hospitalisation, and death. So I want to assure everyone that we are working hard to respond to this threat. Both the Scottish Drugs Forum and Public Health Scotland have published guidance and resources on their website and in print about these substances and about the importance of carrying naloxone and using it. And I would encourage you all to share that information as widely as possible. I'm delighted, just on a visit this morning, I was trained in naloxone use and I will carry it. I hope that I don't have to use it, but actually given that when I'm down here in work, I live in Edinburgh city centre, I think the chances of needing to use it are relatively high. So I am delighted to see so many people at this conference today. The work being undertaken across Scotland in this area is of huge importance, and I want to thank all of you for your hard work and devotion to the cause. The people in this room are a critical part of the solution. By working together, we can reduce drug and alcohol harms and we can save lives. Thank you all for your time today. I look forward to hearing from my officials who have managed to attend the whole conference on some of the other sessions that have been covered. Thank you.